Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. I'm starting a series on psychiatry where I'll make videos on frequently asked questions in university exams. So let's learn about delirium tremens. Okay, you can see here in the bottle what happens when you're high. So delirium tremens is a severe and life-threatening complication of alcohol withdrawal. Okay. So what is delirium tremens? It is severe and life-threatening complication of alcohol withdrawal. Onset, it occurs 2 to 5 days after abrupt cessation or reduction of heavy alcohol intake. Okay. What are the risk factors? Chronic heavy alcohol use, sudden alcohol withdrawal, and hepatic dysfunction. Along with that, previous withdrawal seizures and delirium tremens. Electrolyte imbalance, dehydration, and malnutrition. So these are the risk factors for delirium tremens. So what are the clinical features for delirium tremens? Characteristic tremors, ataxia, and myoclonus. Okay, this is neuromuscular. So what are the neuromuscular clinical feature? Characteristic tremors, ataxia, and myoclonus. Then visual Lilliputian hallucination. Visual Lilliputian hallucination. Then illusions, nightmares, paranoid ideas. So these comes under perceptual disturbances. Okay. Then in general symptoms we have clouding of consciousness, disorientation, agitation, restlessness, insomnia, fluctuating levels of awareness. So these comes under general symptoms. And in autonomic symptoms we have tachycardia, hypertension, fever, sweating, and dilated pupils. So till now we have seen what is delirium tremens, what is the onset, what are the risk factors, what are the clinical features, may it be neuromuscular, perceptual disturbances, general symptoms, and autonomic symptoms. Now coming to the complications. Complications are withdrawal seizures, arrhythmias, cardiovascular collapse, and that will lead to high mortality. Now what is the management of delirium tremens? So it is an emergency that I have told you in the starting only. It is a life-threatening complication. So emergency, you have to admit it in ICU. Then we have to start with benzodiazepines, that is the first line of drug, and we have to give it IV, intravenous. Diazepam or lorazepam. Diazepam is 10 to 20 mg IV, okay, and lorazepam is 2 to 4 mg IV or IM, and we have to repeat it in every 15 to 30 minutes. So the first line of drug for delirium tremens is benzodiazepines, that we have to give by IV route. Then we have to go for supportive treatment, or we can write this earlier only. We have to maintain airway, oxygenation, then hydration, correct the electrolyte imbalances, sorry. So we have to write like this. We have to go for supportive treatment, manage the airway, oxygenation, hydration, correct electrolyte imbalance. Then we have to give thiamine before glucose, and thiamine should be given 100 milligram IV or IV only. Then we have to control the psychosis again by giving benzodiazepines. Then we have to monitor the vitals, fluid balances, ECG and renal function test, and then we have to treat the precipitating cause. Okay, so we have to write like this in the exam about the management of delirium tremens. So this was all about delirium tremens. Thank you so much.